got your
Yep.
permission. All right, great. Yay, I'm so excited. Um, so I'll walk you through how this will go. It'll
Great.
be very easy.
I wish I didn't need glasses, but I do. I can't see you.
Oh, put them on.
I
It
know, but these and
makes you look all like
I don't wear glasses normally.
it makes you look even more official.
Okay, okay. Uh-huh.
I actually should be wearing glasses and I don't have them on because I'm in between prescriptions. And so
Uh-huh.
I'm like, do they make it worse right now or better? I'm not sure.
Yeah.
So what will
I,
happen is I'll read your intro, I'll introduce you, and then I have an opener question for you that I ask every guest on the podcast, and I'll walk you through all of that.
okay.
And then I just have some really basic questions set
All
up.
right.
We're just simply going to talk about your background, the services you offer. This is going to be your platform to pitch whatever you want to talk about here. And I have kind of some bullet point ideas that we can go over, but I'm happy with wherever the conversation will go organically. And then
Wonderful.
we'll wrap it up in an hour or less.
Perfect.
Because if there's more to talk about, we can always do another episode. So,
Sounds good. Love
all
it.
right. Okay, let's do this. Welcome to today's episode of Squats and Seances. Today we are talking with Jody Work. Jody is a registered nurse and an established anesthetic nurse with over 12 years of experience, specializing in injectables, laser treatments, and regenerative skin therapies. She is the founder of Beauty Lounge Med Spa in Aptos and has a thriving practice for over 4 years. Her approach is rooted in subtle, natural enhancement, helping patients look refreshed, rested, and like the absolute best version of themselves. Jody
Thank you
is
for that.
known Jody is known for her comprehensive full face assessments and long-term treatment planning, guiding patients through 12-month customized journeys to achieve results that look effortless and undetectable. Over recent years, Jody expanded her practice to include vitamin and peptide IV therapy, which sparked a deep passion for internal wellness and the connection between how we feel and how we age. This inspired her decision to return to school and pursue her nurse practitioner license, a 2.5 year program she began 3 months ago. Her future focus is centered on women's health, specifically optimizing hormones, gut function, and metabolic wellness, supported by peptide therapy. A lifelong Santa Cruz resident, Jody has built lasting relationships within her community and is known for meticulous clinical standards, warm bedside manner, and her ability to make patients feel like family, not just clients. She believes beauty begins internally and feels privileged to help patients age confidently, gracefully, and authentically from the inside out. Welcome, Jody.
Wow. Thank you for that intro.
I love it. For our listeners, I've known Jody for a long time before she even had the practice, and I will attest personally to everything there. It is 100% true. She's fabulous. She has the best bedside manner, and she's really invested in her patients that she sees. So I'm excited to chat with her today. We are going to talk about all things medical aesthetics, different services that are available, questions that I often get from people that want to know what is medical aesthetics, where do I start? So we're going to cover a lot today. We're going to try to keep it in under an hour. But before we get into all of that, the first question that I ask every first time guest on the podcast is, what does gritty mean to you?
That means rolling up my sleeve and my sleeves, that is, and um, dedicating all of my energy while I'm awake and asleep of just of knowledge. You know, what does gritty mean? Gosh,
Mhm. It can mean many things to different
yeah,
people.
yeah. It means you're gonna, yeah, roll up your sleeves and get dirty and do what you have to do to make things happen.
Yeah, get it done, right? I love that answer. Thank
Yeah,
you. Okay, you ready to get into the fun stuff?
let's do it.
Okay, let's chat about all things medical aesthetics, but I want to start with you and your backstory. Where did you first get exposed to this field of work? And where did you transfer from, you know, registered nurse if you were in a clinical practice into the field that you're in now?
Yeah, I fell in love with the aesthetics field early on in my career. Out of college, they weren't hiring in the hospitals, and so I went to work at Central California Alliance for Health, where we managed Medi-Cal's money, and I was the prior authorization nurse and quality improvement nurse. And after doing that for about 3 years, I was like, what am I doing? This is not why I went
Right.
into nursing. And I need to touch and feel people and, make people feel good. So it was a good learning lesson. But I then went into pediatric home care,
Mm,
and that was very rewarding and very challenging
right.
as well. And then that for about a year. And then I started obsessing over dermatology. And I've always loved just, fashion and beauty and skincare, and saw this whole world that I didn't even know existed going to nursing school.
Mhm.
And got hired on with California Skin Institute, and was there for about 3 years as their aesthetics nurse in Ryan Ranch and Salinas. And it
Mm,
was a great foundation to really learn from the ground up by great practitioners. But they didn't let nurses at the time inject. So it was
oh.
just solely like treatments and procedures, and
Mhm.
which I actually was grateful for. Um, because as a nurse, I didn't, going into a new field, I didn't really know what I was doing anyhow. But after about 3 years, I was like, okay, now I want to start injecting.
Right, I'm done watching. I want to do it.
Yes. And so got hired on with somebody here back in Capitola,
Mhm.
and realized how much I missed working in my community, number one, being down in Salinas and Ryan Ranch. And then went on to another place. And after being there for about 4 years, I was like, man, if she can do this, I can too.
Yes.
And I saw a lot of gaps that needed improvement,
Mhm.
and was on a mission to partner with, a medical director, and found one, and it's been the best thing ever.
Oh, it's
So
amazing.
I originally did it just to work a few days a week and have my own
Hmm.
schedule.
Hmm.
And now we are just growing at a fast rate. I just hired my second nurse and have a wonderful office manager. And so I'm
Yeah,
obsessed.
it's amazing. I can attest to watching that growth happen too, and it's been really neat to see that the quality of the care you provide, I think, is really what differentiates, right? Because you could potentially go and get most of these treatments anywhere, but your investment in helping your patients understand what it is they're getting and maybe what it is they need or don't need, that makes a huge difference. So thank you for
Yeah.
sharing the backstory.
Yeah. Thank you. I am all about the experience, and I want the 5-star experience, and I want a place where patients don't feel rushed.
Mhm.
I don't want them to be a number. Everybody is like family here,
Mhm.
and yeah, and I love
Yeah.
it.
And for those listeners that are wondering, we have a pretty wide listener base. This is in Santa Cruz, California, on the West Coast. So sorry, guys, if you're not in this area.
It's so cute.
But if you come visit, you should come see her. All right, let's talk about the different treatments. I have some big bucket groups that I put together, and I would love to chat briefly about what each one of these things are.
Great.
And we're just going to approach this from the standpoint of maybe somebody doesn't know. They don't know anything. They've never heard
Yep.
about this before. We've got laser treatments, tox injections, filler, skin lightening, microneedling, and kind of the Mac Daddy of things now, peptide therapy.
Yes.
Those are like big buckets. And I think within each of those are going to be many different types of treatments. Are there any other major treatment groups I'm leaving out that you offer specifically?
Yeah, I would say laser slash IPL is one of my favorites, or a BBL, and then a CO2 laser we do not offer.
Mm.
They're pretty expensive and a lot of downtime, but
Mhm.
an amazing treatment in itself for sure.
Okay, so let's start with laser treatments. we've got all these different types. Let's focus on the ones that you offer specifically.
Hmm.
What do you do in house? And maybe just here's what this treatment is, and like this is the name of the treatment, and this is what the main thing
What
that
it
it
does.
addresses.
Yes, so we have an intense pulse light device. Most people might think it looks like a laser, but it's amazing for building collagen, as well as getting rid of broken capillaries, rosacea, and then my favorite is pigmentation,
Okay.
which I think it's the best for.
Hmm.
And usually it takes about 3 treatments to start, about a month apart. And it's incredible. Like during the treatment, the pigmentation usually will get darker.
Hmm.
And then over a few weeks, it'll start to flake off. And then the pigmentation is lighter underneath. And then you come back in a month and we jack up the energy and we hit it harder
Yeah.
and until it's gone.
Great.
Or with the broken capillaries, if I get it with the right amount of energy, it just disappears right before my eyes, and
Oh,
it's
wow.
so
That's like
satisfying.
magic.
Yeah, it is. And then
That's,
when they don't respond, then they make me really mad.
you're like, that's it. We're gonna turn it up.
Yes.
Okay, so that must be IPL.
Yep.
Okay. And what was the other one that you mentioned?
Um,
B something.
BBL, we don't have it, but very
Mhm.
similar. So basically, with the IPL or the BBL, we have different filters
Mm,
that we can push or on the handpiece itself, and they reach different depths and layers of the skin. And so for instance, it has a laser hair filter or a collagen-inducing filter
okay.
where we're activating that process during the treatment. And then people like 2 weeks later will notice a little glow, and it's because we've
Hmm.
activated that collagen production. And then it's vessels, and then it's pigmentation, then it's acne scar. So it starts like with the deepest to the
Hmm.
most superficial, being the acne and the pigmentation.
Great. And interesting note on the collagen, that is such a buzzword right now. Everybody's like collagen this, collagen that, put it in your
Yes,
coffee, drink it, inject it,
totally.
whatever, but we essentially were born with a finite amount, right? And then as we age, it degrades down, and then we start to see those losses in our face and in
Yep.
other places in our body. Do you know what is specific to the laser treatment that helps regenerate, or how,
It
how
has
does that
to,
work? Yeah,
yeah, that's a great question that I probably don't know that well, although I just
that's
know that
okay.
it's that, yeah, that the filter is reaching the energy I push with joules, it
Hmm.
goes to the exact like location in the dermis that activates that collagen reproduction.
Okay.
And pretty much all of our treatments, whether it be microneedling or even Sculptra or everything is inducing collagen. We're just
Mm.
doing it kind of differently.
Yeah, targeting all the different ways we can try to get those cells to
Hmm.
wake up.
Hmm.
Awesome. All right, let's talk about tox next. So tox being shorthand for Botox, which is like the original, the OG.
Yep.
I know there's a few different types, or maybe there's even more than I understand. Could you speak on what are the different types that are available? What are they used for generally? Because
Yeah.
there,
So
there
there's
is like a huge part of the populace, my mother's generation in particular, never done it, never tried
no,
it. And so this is, I think, something that's really kind of unique to our generation. We're going to be the first generation of
for
women
sure.
that are going to age very differently than our predecessors. So,
Yes. Yes, the Botox, like you said, is the OG. Then we have Dysport, which I'm a big fan of. Um, then we have Daxify. He's the new kid on the block with a peptide that makes it last longer and gives
mm,
you a really nice glow. There is Xeomin, and then the new kid on the block is a Ledibo. And so I'm a big fan of Dysport and Daxify for the reason being is I find that they act faster.
mm,
And when I want it now.
right.
So I don't want to wait 2 full weeks for it to kick in. Um, Xeomin, they kind of target that they're cleaner because it doesn't have this unnecessary, um, I'm going to forget the word right now.
Adjuvants to it.
Yeah, but from what I learned in dermatology is that honestly, once we reconstitute it, it doesn't even matter, but it's
Mhm.
a good selling point. I could be wrong on that, but that's what I understand. And then Ledibo, like I said, just came in from Korea, South Korea, and
Oh.
I've played with a little bit, but I don't like it as much.
Are
Uh,
all of the different talks formulations or brands, are they made by independent pharmacies, or is it essentially different formulations, but they're all kind of made by the same pharmacy and
Yeah,
then
they're the
labels are
different
slapped on it?
different manufacturers and slightly different. They're all this botulinum A category, but they're
Mhm.
slightly with little different concoctions.
Okay, interesting. And for those that have never done it before, could you walk through what it's like to get a tox injection the very first time?
Yeah. Well, in our office, we start with a full face assessment. And
Mhm.
so I basically go through muscle movement from glabella to forehead to crow's to lower face. And I educate on what each muscle does and how Botox really, and I say Botox generically, but
Right.
relaxes muscles and making sure that they understand that it doesn't get rid of wrinkles.
No.
It causes muscles not to contract so that the appearance of the lines soften.
Mhm.
If we do that a couple times and you still have these lines that bother you, then we talk about other modalities such as filler or other
Mhm.
things that might help with that. So, yeah, generally we go through first an initial assessment, and then on our first appointment, I'm always very conservative
Mhm.
because it's our first time together. And then I bring you back in 2 weeks and we reassess your muscle movement and see if we want a little bit more.
Mhm.
And then I just always make sure that they're aware, though, that dosage equals duration. And so, on average, is supposed to last 3 to 4 months. But if we do a little less, then it might not last as long. And there is no norm. Everybody's so different.
Mhm. Yeah.
But
And based on lifestyle, right, and environment, um, obviously I love my Botox listeners. That's my connection with Jody. But I work out in a heated room 7 days a week, and that expedites the metabolism of the tox. And so, and let's chat a little bit real briefly about that dance between building resistance
mhm,
to the tox and the duration, right? Like you said, dosage equals, what did you say? Dosage.
duration.
Mhm. And so if you have a lifestyle, where you're aggressively sweating and
Yep.
clearing things through your pores, for someone like me, it's not going to last as long.
Yep.
However, I make a conscious decision to try to stretch those treatments as long as possible, because the more often I go in there, the less response I'm going to get,
Yep.
right? Am I understanding
Yep.
that right? Okay.
Yep. And we will always recommend that you wait at least 90 days in between treatments. There's a great uh, image that I need to get printed out here because people think that it lasts 3 months, but really it's like kicking in the first 2 weeks, and then it looks really good for like 6 weeks. So now we're at 2 months, and
Yep.
then really that last month it's declining.
Yeah.
And so, but we want to wait that 90 days, even though you might still have muscle movement coming back. I've also heard that sometimes switching it up,
Hmm.
so like getting Dysport, and then throwing in a Daxify
Hmm.
so that your body doesn't build that tolerance.
Yeah.
I've heard that can help too.
Yeah. This is why Jody's great, guys.
Thank you.
Let's talk about filler. That seems like a great segue. So,
Yeah.
tried the talks. Maybe I'm somebody that waited a long time. I have some really deep set wrinkles in my face as
Hmm.
I age, which is natural, guys. Like we're not trying not to age here. We just want to age
Yes.
gracefully and feel comfortable in our bodies while we do that. So
Yes.
now I've got these wrinkles. I tried talks. I've essentially kind of slowed or almost halted the progression of new wrinkles forming from the deep holding patterns of the muscles. My frown lines or my titties are stressing me out again, or my husband didn't get something right and I got this thing going on, right? Whatever that
Yes.
might be, it's still
Yes.
there.
Yes.
Filler, is that kind of the next category we want to chat
It
about?
can be. I would
Okay.
say that filler is the last tool in my toolbox. And I feel like the older I get, the more demanding I get with I argued, not argued, but I had to educate somebody a couple weeks ago for a half hour why I was
Yeah.
not going to put filler in your face.
Yeah.
And it really starts with um, you need to be on medical grade skincare. Like if you're not even
Hmm.
going to do that, I tell people it's like going to the dentist twice a year and not flossing and brushing. Like it starts with
Hmm.
you at home. And
Hmm.
so you're investing in all of these treatments. And so now I'm, yeah, becoming a little bit more demanding.
Yeah.
Or, I get pretty much a fifth of a teaspoon for, let's say, $750, and I'm supposed to make magic happen.
Yes.
And so what I am now recommending is that, you do your micro needling, which we'll talk about
Yep.
coming up with radio frequency, which helps tighten. We're going to do your IPL because we need to get rid of the pigmentation and really have that canvas set.
Hmm.
Um, then of course, we're going to do our talks, and then really everybody needs Sculptra. And so that's why you briefly mentioned that I am now going, especially going into 2026,
Yeah.
focusing on our treatment plans. And, people will come to me and it's like, I need a year. I
Yeah.
need a year to do all the things because nothing is one and done. And if you really understand the aging process and what's going on, it's happening at all these different layers
Yes.
in the skin too.
And I feel that that is a financially responsible as well as medically ethical, right? But
Yeah,
in there's always this weird it's a challenge to maintain ethics in for-profit industries. I know that intimately with veterinary medicine, and I've seen it in certain healthcare circles. But it is important to be like, no, like look at the bigger picture. If this is where you want to be in a year, better that we have a structured plan to get there than you're just throwing money at things out of order that don't
yeah,
make sense. Like, right? I think that that is a wonderful idea, and I wish that there were maybe more clinics that were doing that. I've been
yeah,
around to a few of them and I don't, a lot of them are just happy to give you whatever, walk in,
yeah,
take your money. Okay, sure. And then you're back 3 months later, like, well, how come this didn't get fixed? Or it's
totally.
right back where I started.
Or a lot of
So
people just want lips, and it's like, no, actually, lips is like the last thing I
the last
even
thing
touch
you
on
should be
you.
doing, right?
Yeah, it's just like we got to build the structure, and that's like the icing on the cake to
Yeah.
me.
And I imagine this is a tangent, but I'm sure social media in general doesn't
Oh,
help. It propagates these ideas of like, this is what it looks like when you have your lips done. And all I did was my lips. And now my whole face magically looks
yeah,
20 years younger.
totally.
That's a
Big time.
filter.
Yes, yes, and yes.
So of the different types of fillers, because I know that there's many,
Yep,
when you get to that point with a client,
yep.
what is your preferred one? And what does that look like in the session with you?
Great question.
Mhm.
So I'm obsessed with the RH collection, and it's pretty much, I did a Restylane hands today actually, but um, RHA. It's by
RHA. Okay.
Revance is the company, and they have four different ones. Yeah, I say I have my RHA 4, which is like the quarterback, and he
Mhm.
helps, build structure. And then I have my Redensity, which is like it's like honey. I
Mhm.
can do an upper lip and you
Softer.
wouldn't even see it. But it has changed the ball game, and it actually, for the first time in my life, I like filler.
Mhm.
Or if I'm going to like filler, it's really the ideal one for me. You can place it superficially, and it moves with dynamic smiling. So it's
Mhm.
not, some people think filler and it's like I got these fish lips and these big cheeks, and
Yes.
but here it's just like it just
It's
moves with your
fluid.
dynamic smiling. So I'm obsessed.
Oh,
Yeah.
great. All right, let's chat about skin tightening. Is this Sculptra?
So Sculptra, I plan to be the queen of Sculptra here in Santa Cruz.
Okay, what is Sculptra? I've never
Yeah,
done
great.
it.
Yeah, great question. So, it is a polylactic acid. It's an injectable.
Okay.
It's mainly meant for the temples and then preauricular, some down here, marionette. You may not inject it around the lips or the eyes,
Mhm.
but really, it's like inducing collagen. It's like throwing the grass for the seeds for the grass to grow for
Mhm.
your collagen. So
Okay, it's like
basically,
seeding. Hmm.
so I inject in these areas this polylactic acid. Your body says, "Oh my gosh, I'm injured. What is this foreign subject in my body?" And then over the next 6 weeks, your body induces collagen, and then the collagen is excrete. I'm sorry, the polylactic acid is excreted, and the collagen replaces where the polylactic acid was, if that makes sense.
Yeah, yeah, yeah. You're stimulating an immune response on that level
Yep.
in the face.
Exactly. And so generally we'll start with like 2 vials,
Hmm.
and then come back in 6 weeks, most likely going to do another one. And
Hmm.
then you may need up to 1 vial per decade of your life. And that's just, there is no norm, right? Everybody presents so differently, but I'd like to tell people, that, and hopefully they don't, but I'm all about realistic
Yeah.
expectations. And then it's like once a year, you just need one. So it's an
Hmm.
investment up front,
Hmm.
but everybody over 35, in my opinion, um,
Okay.
should make that investment.
Yeah. And have you done it on yourself? You've
Of
done,
course.
yes.
It's probably
Yeah.
been, I'm due. I'm
Yeah.
due. This is why I have two new nurses and I'm training them so they can do
Yep.
certain things on me that I can't do on
Yes.
myself.
There you go. And
Yeah, it's
is
been a good
this,
5 years or so. I'm due.
I was going to say a vial every 10 years sounds like a screaming deal to
No,
me, but
not every 10, every year.
oh, a vial once a year. Okay, got it.
Yes.
All right. That
Yes.
also seems pretty good
Yes.
considering.
After you do that initial investment up
Hmm.
front,
Yeah.
where you do the 3 or 4 or 5 or whatever,
Yeah.
then once a year. And
And
people love it.
is this in the category of microneedling or is this skin
It is
tightening?
not.
Okay.
Yeah, it'd be more just collagen inducing. Skin tightening, radio frequency helps tighten. Maybe some ultrasound helps tighten, but there's just nothing like surgery.
Yeah.
And, so yeah, kind of going into the microneedling or skin
Yeah. Let's chat
tightening.
about that.
Yeah, so we have our microneedling device, which has radio frequency. And so the microneedles themselves, it's not just like a little pen, it's a big bad boy on steroids.
Oh boy.
And I basically program what depth to go to and how much energy to be delivered, which is the tightening aspect of it. So it's going down, let's say 2 millimeters deep or however I program it, and it's causing these micro injuries. Your
Hmm.
body is saying, oh my gosh, I'm injured. Let me induce collagen.
Hmm.
And then at the same time, it's tightening at each one of those levels. So I'm
Because
going
of
deep.
the radio frequency, right?
Yep,
Okay.
exactly. So I go deep, then mid dermis, and then superficial. Um, and you get improvement 100%. I think what has taken it to another level for me as far as end results are my exosomes that I infuse in after.
That's what I was going to ask. If there was
Yeah.
anything during the process that was being infused, or do you do the microneedling and then you put something on the face with
Yep.
all of the openness that you've created?
Exactly. Now
Okay.
you're this open wound.
Yeah.
And I used to like make my own concoction of vitamin C and glutathione and CBD and B12, and that was good. But now these exosomes, which are like stem cells, and
Hmm.
they love injury and inflammation and repair. And so they get so excited when they
Yeah.
have this inflammation. And so I infuse 5 billion of them and
Wow.
they go get to work. And they, for about 6 weeks, they're down in there because they have these channels that they've outright delivered deeper into the dermis. And then we throw on the CO2 mask that it's a carboxy treatment and it pushes all the exosomes deeper into the
Hmm.
dermis and it hydrates and oxygenates the tissues. And it's one of my favorite treatments right
Yeah. I'm
now.
like, that sounds amazing.
Nummy.
What are your thoughts on some of the home microneedling kits that you see all over the internet right
I think they're,
now?
uh, I think that any injury can help cause a little collagen induction.
Hmm.
So you want to get a little derma roller or something. If you use it as directed,
Yeah,
whatever
safely.
that looks like, it's every 2 weeks on a Friday night, you do it. Nobody's going to do it. And so therefore it's a waste of your time and your money and it's going to sit in your drawer.
Yeah.
But could it do a little something? Sure. But you're right, it's a waste of
No.
time.
Yeah. I know that there's a lot of them right now that are out there that market different infusion serums and, before and after and
Yeah.
but it doesn't
And honest,
have that radio frequency element that you have.
yeah, it
So
doesn't
that
have that
there's
in
not.
the, yeah, and I
And
kind
the
of take that back. I
exosomes.
mean, those little things that you fill with some serum, they could give you a nice little glow,
Hmm.
you know,
Yeah.
if you do it.
Yeah. But it is a lot to poke your face over and over again with.
Yeah, again, those of us are so busy. Are we
Yeah. When you
really going
gotta,
to do it?
yeah,
Maybe before a,
before like once in a while, it would be hard. All right, let's chat about peptide therapy. I'm excited to,
mm-mm.
because I know that there are so many things that are out there. Where should we start?
Mm-mm. I mean, yeah, where should we start? So we've been doing peptides for a couple of years now,
Mhm.
um, mostly injectables. It all started during COVID, actually, for me. I was going to Be Well IV and spending a lot of money on the vitamins and peptides and IVs myself.
Yeah.
And spoke with Dr. Gilbert and was like, man, we need to bring this in our practice. And now it's so fun to be a part of people's journeys on the results,
Mhm.
whether it be a peptide IV infusion. I think half of the time people just feel better, honestly, because they're dehydrated, and
Right.
just the hydration alone, they feel better. But um,
Maybe that
or
would be a great place to start if I can just interject
yeah,
real quick. Let's start with the IV
yep,
options, like an actual IV
yep,
infusion, and
yep.
then talk about the injectables, the vitamins and the peptides and the different combinations that you can do. So
I
what do you
love
do?
it.
IV infused.
Yes. So we start with the Myers cocktail. And I like to say the Myers cocktail is like pulling up to get premium gas. So you're going to
Love
fill up
it.
your tank and you're going to get all the vitamin B's and C's and magnesium and calcium, and you're going to feel amazing.
Mhm,
And then I say, belly up to the bar and
mhm,
tell me your ailment, and I'll give you up to 3 shots.
mhm.
So, do you want to work on immunity? Do you need energy? Do you have an injury? Do you
Yeah.
want help with rest and recovery? And then we can recommend some of the peptides or vitamins. Um, and yeah, we have these nutritional gaps. I find. So let's say, for instance, you're coming in every month, or every other week for Myers, and then it's once a month. Everyone's so different, it kind of depends. But um, then you can add on, like I said, you can, if you wanted to work on immunity, we can
Mhm.
do a glutathione push, or for to cleanse your liver. Um, yeah, there are just so many. My favorites, I have peptides.
Yeah, there's a million different ones. So it sounds like the infusion with the IV is kind of an all-purpose. It's got all of these different things. Do clients have to do, or patients rather, do they need to have any kind of blood work beforehand done?
Yeah, great question.
Okay.
So you speak with one of our nurse practitioners prior to treatment,
Hmm.
and they go through a series of questions to make sure that you are a good candidate for treatment, which most people are. And then we go from there. So
Hmm.
you do not need blood work for the IV vitamin infusions. We do offer the GLP-1s with the weight loss, and that you do have to have lab work within the last like 6 months. Yes.
Yeah. Okay, great. So nothing needed just for the feel good cocktail. Just
Yep.
going to fill out all of those gaps that might be present. Let's talk about some of the specific vitamin injections. I've personally, I know I'm a big fan of the immunity one.
Yeah.
Can you tell me what's in your cocktail that you use? And you don't have to give dosages or anything to
Yeah. Yeah.
keep all your
Just,
proprietary stuff, but
yeah. No,
it's
the
vitamin C and what else?
glutathione.
Okay. And for those that don't know how glutathione works or what it is, could you explain that?
Man, well, I mean, it's helping cleanse the liver, and but no, I don't know exactly how it works.
That's okay. I'm pretty sure that it's a liver detoxifier because the
Yes.
liver is what metabolizes everything.
Yes.
So you've got vitamin C and you've got glutathione. Is there anything else in the immune one?
If there is, that's there like a little, there's not much of it in
Okay.
there. I think there are a couple of little ingredients, but those
Yeah.
are the go-tos, and
Yeah.
pretty much like you've experienced, I think too, is that you feel a little scratch in your throat and you take a
Yep.
shot and the next day it's gone. That's
Yep.
pretty amazing.
With a toddler and two teens, I have definitely used the vitamin or the immunity vitamin injection when I felt like I was about to get sick and I didn't. It's
It
several
really
different
works.
times. Yeah. I know you have vitamin B. You have like a
Yep.
vitamin B complex. And
Yep.
generally speaking, what does that do for support?
Yep.
Like,
Usually we'll use that to just increase energy.
mhm,
You sleep better. It also helps support your immune system. Good to reduce stress. Those would
yeah,
be kind of the main ones.
the main ones. Okay. Anything else in the vitamin world before we talk about GLP-1s and other ways to support like medical grade weight loss?
Well, we have like a slim shot where we will add this MIC, but those really the C's and the B's, the glutathione, those would be the main ones that we use. We have an ALA, nothing worth talking about, but
Okay.
that are as good as those.
Yeah, yeah. And then because I am just personally coming off of a pretty significant hamstring injury, you and I
Hmm.
were talking about I can't read it was B something
Yeah,
with a seven. And
BPC 157.
okay, what is that and how does it
Yes,
work?
it is my one of my go-tos. I'm on it now. You do have to cycle on a lot of these peptides. It's amazing for gut health. It's great for decreasing inflammation. It's great for injury recovery,
Mhm,
increasing blood flow to an injury to help repair.
mhm.
It's just all around
Yeah,
goodness.
the research I did on it said that it's literally BPC stands for like body protective compound or something
Yep,
crazy like that.
yep,
And that the more locally it is injected to the source of injury,
yep.
that it stimulates the body to
Blood
help
flow.
rebuild. Okay. So vascularity increases, we're going to get more white blood cells to that area and get a heightened immune response to try to build back whatever was broken.
And it really works. I
Yeah.
mean, I probably last year this time, I couldn't even walk up our stairs here at work.
Oh, wow.
And I would say I'm like 85 to 90% better. I'm definitely not having surgery anymore.
Yeah. That's
I've used
amazing.
it,
Do
yeah,
you mind sharing what part of the body
on
you were
my
using?
meniscus.
Oh, okay, on one of your
Yep.
knees. All
Yep. So
right.
would just go right to the area. My 18-year-old son had a torn labrum.
Hmm.
He's not having surgery anymore. It's pretty amazing.
Wow. And you're not injecting into the joint, right? With those
No.
things. You're just in the local area.
Yep.
Okay, I was going to say, because joint and sterility injections, that sounds
Yeah,
scary
you
to
might need to go
me.
see a doctor for
You
that.
might need to
Yes.
go into an OR for that
Yes.
one.
Yes.
Okay. So we've got, what else do we have? Let's talk about GLP-1s.
Hmm.
Huge following on those these days.
Yeah.
No longer just for the those that struggle with like genetic reasons for needing to be on it, whether that's blood sugar issues or weight issues, but what do you offer and what have you seen it do for
It has
patients?
been life-changing. And
Mhm.
it, again, it's been so fun to be a part of people's processes. And it's the best thing ever
Mhm.
since since
Since
penicillin.
sliced bread,
I
since sliced
mean,
white bread, apparently.
yeah,
So we're gonna get
because
our glucose way up.
yeah, so many people and I have everyone from losing 70 pounds to 30 pounds to that last 10 pounds that you just couldn't get rid of
Mhm.
because now I got hormones and even those
Yeah.
which actually, as I say that, if your hormones aren't regulated, then don't even waste your time getting on the GLP-1s because you need to address that first. But
Mhm.
um,
Is that one of the things that your clinician looks at in the blood panel? Do you check hormones before someone goes on a GLP-1?
we do, but we do not follow them for it. I refer out to have them
Mhm.
look at their hormones, but we do look at them, yeah.
Okay. And are there any particular hormones that come to mind that it's like if these are not playing well in the sandbox, we're not even going to proceed with the GLP-1? And what would those be?
Yeah, I am just a nurse that follows orders. So,
That's true. Well, as soon
um,
as you're the nurse practitioner,
yes,
we'll get to know the answer to that
that's
question.
that's why I'm back in school.
I
Exactly.
love it. Well, okay, but
Yes,
that's good to know because I don't
yeah,
think, and you can literally get a GLP-1 off the internet. You don't have to really be
I
screened by
know.
anybody.
It's a little scary.
It is. It is. And so I've never heard anybody say, "Oh, well, like, look, you need to look at this whole hormone panel before as well." So I'd be really curious to see what's tied
Yeah,
into that.
it's not required, but as we are ordering blood work, it's a little add-on, why not? Just so
Yeah,
again, they can take their next steps and
best
go get that figured
practice,
out.
right? Like, if
Totally.
why not look at that? Because, like you're saying, if you're estrogen, progesterone, testosterone, whatever, it's not where it should be. You're essentially fighting an uphill battle, right?
Big
So you're
time.
going to cut your satiety symptoms, but it's like putting a band-aid on something that's just going to keep coming back.
Exactly.
So I completely understand that. So for GLP-1s, used to be mainly just for people that needed to lose a large amount of weight, needed to
Mhm.
get blood sugar under control. They were at risk of being long-term diabetics. Now I'm hearing more long-term studies on blood sugar regulation and is there something else I'm missing? I know that
There
there
are
are.
like a million reasons why I will never get off.
Yeah.
In a micro dosing state,
Okay.
they are finding that there's so many other health benefits.
Hmm.
The list is so long. I mean, and there's peer journals that are coming out, and decrease in Alzheimer's and dementia, decrease in 13 different cancers related to diabetes, decrease
Wow.
in sleep apnea. Like the
I
list
think I
goes
read
on and
something about a
on.
tie-in to depression as well. Like this seems to be like a miracle peptide, for
It
lack of a
really
better
is
word.
a lot, and
Yeah.
it's been out forever. Again, the I have so many, not so many, but I have a handful of people that will get to their desired weight. We stay there for another month and wean them off and down,
Mhm.
and they just don't feel as good when they get off
Yeah.
of it because the bloating, the inflammation,
The
there's
high
just so
and lows, right, of the blood
many.
sugar. I mean, that
Yeah,
part alone, that's huge for a lot of people. You don't realize
big.
how much you're impacted by your glucose levels,
Yeah,
um, and and the body's natural processing of, you eat something, there's sugar, the pancreas releases insulin, drive the blood sugar into the cells and try to, like try to process it. And then you just have this wave you're riding. You feel good, you feel bad, you feel good, you feel extra bad. Like to just kind of be static helps everything feel more calm, right? So,
yeah. People are just able to like listen to their bodies a little bit more,
mhm.
to help with the food chatter and decrease the cravings. And
Yeah.
um, yeah, I think it's the best thing ever.
Last one that comes to mind,
Yes.
NAD plus.
Yes.
Yes,
You
let's
know
talk
my
about
story.
that.
I'll give you my spiel. You've
Yes,
probably heard
it's
it
okay.
5 times,
Tell it,
but
tell it to
I'll,
our listeners because
yes.
if you, again, another very popular compound, you can find it pretty much anywhere, been around for a long time, lots of different variants. Best route of absorption, hands down, is going to be injectable.
Yes.
So what does it do generally? Like how do people feel
Yep.
when they take it and why do they need it?
Yes. So NAD is something that our cells naturally need in order to function, but decrease with age, just like everything else.
Yep.
And I like the image of the headlamp to your car being like your cell, and it gets mucky from all the things. And so when I push the NAD subcutaneously, usually in the abdomen, it kind of washes that headlamp clean of all the debris,
Yeah.
and now your cells can receive their signals better.
Yeah.
And so you just feel a little bit more clarity, more energized, and it is a real thing.
Yeah, it is. I love it.
Yeah, it's a little addicting, really, because you
Yeah.
feel so amazing on it.
Hmm. And I did notice in my own personal experience when I would be far out from having supplemented with it, I'm like, man, I'm just really tired all the
Yeah,
time. Can't figure out why.
yeah,
So big fan of NAD plus. All right, I've got just a few more questions for you. I know I knew
sounds
this
good.
conversation would go fast. So many
Yes,
things. People are going to
yes.
love all of this wisdom you're dropping on us here and all the
Uh,
different things that we can do. Um, all righty. So we chatted about many of the services. I would love to know right at this moment of all the things we've talked about, what is your favorite treatment at this moment and why? If you could only pick one.
My favorite treatment right now is my microneedling device with radio frequency topped with 5 billion exosomes in my CO2 masks.
This is
Um,
Sculptra, right?
nope,
No,
yep, it's just again my microneedling device.
microneedling. Okay,
And
got
then
it.
I infuse those 5 billion exosomes. It's just been the exosomes took it to another level.
Hmm.
I had one lady recently that came to me who had melasma, and we weren't even treating for melasma, and we were treating for tightening of the lower face. And after one treatment, she came back, and like 70% of it was gone. It was crazy.
Wow.
And so I see those pictures in the brochures or what have you, but I don't believe anything until I see it anyhow.
Yeah, I'm
Most
similar.
recently, we have started to implement hair regrowth with the exosomes too. And so you do little micro channels. In
Hmm.
fact, another case just about a month ago, she has alopecia, which is
Hmm.
she's losing her
Hair
hair.
loss. Hmm.
And she's working with her doctors to try and figure out what's going on. I thought, let me just do a little micro needling up here
And
with
see.
your treatment, and then let me just spray a little exosomes on there because we're going to start to offer this service. And normally, the hair protocol is infuse 10 billion exosomes just in the area. And
Hmm.
I just sprayed right in the face is 5 billion, and I just sprayed a barely a little bit. And last Monday, she came in and she already has little hairs growing.
Oh my
I
gosh.
know.
Oh, that's so
So they
exciting.
just really work.
Yeah.
You can actually off-label inject them into torn, just like a stem cell,
Hmm.
inject them into injury too, because as I mentioned earlier, they love injury and inflammation and repair. And basically, wherever you put it, just like a stem cell, it gets to work and does its job wherever you put it.
Oh, it's amazing.
So that would be my one favorite treatment. But side note, just internal wellness is my more passion right now, which,
Hmm.
like you mentioned in my intro, is why I've gone back to school. And I really want to be able to get into your gut
Yeah.
and your hormones and
Hmm.
make you feel good because you can look good, but if we don't feel good, then I just want to
Yeah.
help
It's
in
an
that
it's an
area too.
inside job, right? It all starts
Yeah.
there. And so much of what we experience, this is an interesting tie-in, right? There's all of these um, physiologic receptors in the gut that tie into our mental health as well. So
Big time.
it's functional medicine essentially. This is
Yeah.
like functional medical aesthetics is what you're
Yep.
describing.
Yep.
Is how do we treat the body as a whole organism
Yes.
versus just looking superficially? We can treat the face superficially.
Yes.
We could treat any part of the body on the surface level. But if we
Totally.
don't understand what's happening on the inside,
Yep.
those results are transient. And like that band-aid analogy again, it's not addressing the root cause of what's happening.
Exactly.
Right. And we all age. And the point here is not to not age or to
No.
pretend that that's not a thing, but can we age in our bodies comfortably and gracefully? Like we don't have to suffer. And I
Yes.
think that that is huge. And speaking of aging, my next two questions sort of tie into each other. They're age related. The first question I thought is, how young is too young to start doing some of these? And then I
Hmm.
thought there's a better way to phrase that.
Hmm.
What is the beginning or what is the treatment option to begin with? At what age? And why would you
Yep.
recommend that? And let's start with that as the first part of the question.
Yeah, I would say 21.
Okay.
For me, I
Mhm.
have a couple of younger girls that have excessive sweating
Mm.
that do it for, I don't have many 21-year-olds coming in for Botox and the glabella or anything.
Yeah.
And honestly, I don't even do their lip filler. I send them to another injector because
Because ethically,
it's just not my yeah, thing.
yeah, that's
But
very
21.
amazing.
Yeah,
21.
21 for
Okay.
injections.
21. And then let's say someone waited until they're way on in life.
Hmm.
And now they're like, well, for whatever reason, I woke up today and I'm just going to throw an arbitrary number out there, in my
Yep.
70s. And I'm like, I
Yep.
can't deal with this face anymore. Like, I
Yep.
don't know why I didn't deal with it now or up until this point. I did nothing to take care of myself. But today is
Yeah.
the day I'm
Yep.
going to make right on 7 decades of neglect. What do you
Yes.
recommend? What
Then
do you
we're
tell them?
then I always pick between either my IPL or my microneedling device, and I
Okay.
base it upon if pigmentation is an issue or if tightening is an issue. And
Hmm.
so we'll start with a series of those.
Hmm.
Then we'll throw in some, it's probably one of my chemical peel series to just help with the overall health and texture and tone and tightening.
Yeah.
Um, and a little tox, always a little tox.
Always, always a little talks. And again, this really does go back to the fact that we're not trying to erase the age. It's just
No.
like, let somebody feel good. Let
I want
them,
you exactly to
yeah.
feel like the more well-rested
Hmm.
version of yourself. And I think one of my slogans is, yes, I want my injectables to be undetectable, not who does your work,
Yeah.
I don't want them. I want you to
Right.
look just like you, just a
Yeah.
little refreshed.
Yeah. Like you just Like you actually got a full night of sleep and
Yes, yes,
had
exactly.
all of the nutrients your body needed. And okay, just a few more. I wanted to ask a little bit more on a personal level for you in your personal experience with medical aesthetics. How does that play into your personal life of balancing body, mind, and spirit? And we've obviously talked about this a few times now throughout this
Hmm.
conversation, but what does that look like for you, for Jody, in your personal life?
Um, what do you mean exactly? Like,
Like, how has using medical aesthetics
okay.
help you feel more balanced in areas not
Hmm.
related to medical aesthetics in your personal life?
Yes, I think that it's hard. I think I'm answering your question. It's hard as an aging woman
Mm,
to like we want to feel good about ourselves, you know, and
yeah.
so I I love Botox. It just makes me feel better.
Hmm.
And I love all the modalities. And even though men might say, like, honey, you don't need it, you look good. But I'm doing it for me because again, it's hard as an aging woman,
Yeah.
with the changes that are happening along with the hormones and the
Yes.
laxicity in your body. And so I love to have these tools in my tool box
Yeah.
to help me feel better about myself.
Yeah. And I love that you say too that this is your decision to do these things for yourself. Not for some outward validation or approval, but it's like I can do this because it makes me feel good. And
Yeah.
I have the right to wake up feeling like $1 million every day.
Yeah.
And if this helps me feel like $1 million, then I'm going to do it.
Yeah.
I love that. Okay, so last thing in closing, the second season, when it airs in the beginning of February, is all about choices that we can each make day to day to optimize our life experiences. If you were to choose one takeaway from our conversation, and I know we covered a lot of ground, what would you recommend to listeners as the key point and why?
Wow, that's a big question.
Of
I
course,
can
it's the finale question. It's got
I
to be the
can
biggest one.
I can go so many ways with that. But from a woman community member here, to wow, I don't even know where to go with that.
Mhm. Well, you could
Like a
choose a couple if you needed
yeah, a
to.
key point. Oh, you're what's the right word?
I got you stumped here because there's a
Yeah.
lot we talked about, all the different treatment options,
Yeah.
all of the peptide therapies, all of the ways that we can kind of treat our body as a functional whole
I don't
organism.
think we really talked about it, but really doing your own research on finding a educated provider.
Oh, that's a
Um,
great answer, Jody. Okay, let's say that again. So, guys, if you're to take away one key thing from this conversation, and this is sort of the sequelae or the things that follow, it's clear that Jody is very knowledgeable and she's invested in the patients that come and see her. And so, on that note, Jody, what would the
mhm.
takeaway be for you?
Yes, to do your research on the provider that you're going to choose to, do your treatments, whether it be a filler treatment, like have they taken a cadaver course and do they know anatomy? Because when you inject filler, you can cause blindness. And
Yeah.
there's so many, with the lasers, you don't want to discount on your face or your body or your
No.
whatever. And
Yeah.
so, yeah, don't get the Groupon Botox and ask do your research on your provider because I know a handful of them that aren't aware of just the basic knowledge of,
Yeah.
and I am obsessed.
Yeah.
And I will recommend so many practitioners in the area that are amazing here. And I love, yeah, community over competition. I think that,
Yeah. Is there a directory or anything of people that have done the extra work to really be
yeah, great
educated?
question. So I am a part of so many different groups of practitioners. One of the that just not, I don't think that you can look at online, but for
Hmm.
myself in particular, we have this group that we've all trained under. and we are all on this list. So if I have a, patient that moves to New York, I can go to
Mhm.
them and be like, okay, I know that you trained with so and so, and we can
Yes.
recommend you, kind of a thing. But no, I think you have to just do your own research and
Okay.
ask questions. It's your
Yes.
body, and yeah.
This community, the Squats and Seances podcast community, is community of the gritty, and it highly embrace the idea of asking questions. Don't just settle for something because somebody says that's what it should be.
Yeah.
Like, do your research. Don't be afraid to ask those hard questions. I really love that answer. So, in closing, where can people find more about your services,
Mhm.
your medical practice, and how do they reach you? What's the best
Yes,
way?
we are at beautyloungemed.com. And we're here in Aptos Village in Santa Cruz, California. And we have big things coming for the new year. I am so excited. We're actually getting ready to rebrand,
Wow.
and all things wellness. And like I said, our little team is growing, and I feel so lucky and grateful to be doing what I love to do every day. And I'm obsessed.
It's awesome. It
Yeah.
shows. Well, thank you, Jody. Thank you
Thank
for
you so
sharing your
much.
wisdom and all of the information that you've provided for listeners. I'll include links in the show notes for getting access to your clinic and where to find you, and we'll connect on social media and all the things. It sounds like we may be operating under a new brand in 2026, but we'll make sure it's all linked.
Yes.
So thank you again so incredibly much. We really
Thank you
appreciate
so
your
much.
time.
Thank you so much.